Have you ever wondered if the tongue staining, like the one you're seeing here, is normal for your child, or is your baby sick and they need to be seen by your health care provider? Join in today's video to learn about, is this a milk stain or is this oral candidiasis in babies, and how you're going to help, or how tips on how to find out if it's one or the other thing, and also how you're going to be able to manage that condition even before you get to the doctor. Welcome to another yet fun episode of Dr. Saru Pendo TV, and in today's video we're going to find out if oral thrush and milk stain is the same thing, or how to differentiate between the two. So a question that I've had several mothers asking, even on Facebook in our group, and by the way, if you're a cesarean mom and you've not joined our Cesarean Mom Kenya group in Facebook, you're missing out on so much information that these ladies keep on dropping. And of course, once in a while I do some lives, and as well as answering your Q&As. So how can you be able to tell if this is oral thrush or this is milk stain? And by the way, if until now you've not realized what we're speaking about, it is the white discoloration on a baby's tongue. That is what we're trying to find out today, if that is normal or that is a sign of infection. And yes, you've heard me say about oral candidiasis or oral thrush several times in this video yet, and you're wondering, what is that? That is a fungal infection, sawa, like the one that women sometimes do complain of getting yeast infection. It's the same fungus that is also causing this on the mouth, or it normally appears on the tongue, but sometimes you can find it even on this region, the buccal mucosa, that is inside your cheeks and at the palate area as well. So now that we know what oral thrush is, or oral candidiasis, let's know what are the differences between milk staining and oral candidiasis. So first of all, we're going to start with milk staining because it's the natural thing and it's the most healthiest thing. It means that your baby is actually getting well fed, and that is why their tongue is getting stained with the milk. So how to know that this is a milk stain? A milk stain is easy to wipe off, and most of the times it appears just immediately after baby's has finished feeding. So this could be a breastfed baby or even a bottle-fed baby. And immediately they're done feeding, you notice that their tongue has turned a bit of sort of like a whitish discoloration. That is one way of finding out that this is a milk stain. Another way you can find out that this is a milk stain is if you take a damp cloth, or you take a piece of cloth, a clean piece of cloth, and it could be baby's clothes as well. Uiweke kwa kamaji kidogo, it could be some warm water, wrap it around your finger as such. So this is a paper. So just wrap it around your finger like this, and then slightly and gently try to wipe off the tongue. You'll see that it comes off easily, and it doesn't have it doesn't leave any redness or any sores or wounds or ulcers on the tongue. It will just be clearly wiped off, and you'll see a healthy looking tongue. And the other thing to identify that this is a milk stain, it does not cause any discomfort when baby is feeding. Now, totally the opposite happens when your baby is suffering from oral thrush or oral candidiasis. What normally happens, you might find that the baby is poorly feeding now or fussy during feeds, because while you try to wipe to see if it's a milk stain or it is candidiasis, you'll notice that with candidiasis is holding firmly onto either the tongue or the palate as you're trying to wipe it off, as opposed to milk stain. So that is one of the reasons, as to why it's normally very painful, and sometimes baby might be feeding poorly because of how the mouth is feeling right now. Of course, you know, a sore is painful. And sometimes when you try to wipe it off as well, you might notice area of bleed in the area that you're trying to wipe because of how it's firmly attached to the tongue or even the oral mucosa, whichever place that you'll be in. So now, if you find out that your daughter or son, your baby, has oral candidiasis, the best thing to do is to go to the hospital so that you can get assisted. there. Meanwhile, if you've wiped off before you go to the hospital and you find that the sore is bleeding, you can as well as put a little salt in the warm water that you're trying to wipe off the tongue with, and just gently wipe it off as you're getting yourself to the hospital. So you can be treated effectively, because as I already told you before, this is a fungal infection, and it's well suited or well best treated with antifungal medication, and that can only be prescribed at the doctor's office. So avoid getting these prescriptions from online, and sometimes people are advising each other wrongly about which drug to take, how to take it. It's good if you have a healthcare provider tell you that piece of information. And if you've been watching this video up till now and you've not yet subscribed to this channel, or liked this video, or even commented and told me your own experience about this, what are you doing? What are you doing? Please do subscribe and click on the button so that you can always be notified. Ding ding, the bell will go off whenever I post a new video. So now, those are the 4 major differences. I think I said 4, 5 major differences between milk staining and candidiasis or oral thrush. So how can the baby get oral thrush, you'd ask yourself. These are some of the ways that can compromise a baby or put them or make them susceptible to getting oral candidiasis. We know very well that fungal infections thrive when the immunity is lowered, or you have conditions that are lowering the immunity, or you're taking medication that is lowering the immunity. So any baby that has been on antibiotics for a while, or a long duration course, or also has been on strong antibiotics, that the taking of the antibiotics will lower your immunity, and it will kill some of the good bacteria and also the bad bacteria, definitely what we are trying to eliminate. But also the good bacteria will be killed in the process, and thus lowering your immunity or your baby's immunity, and in this case now they develop the oral thrush. Another condition, babies who already have immunocompromised conditions, like babies who are affected by HIV or infected by HIV, babies who are undergoing chemotherapy or do have some certain malignancies, or any malignancy for that matter, because it lowers your immunity. Thus, you're going to find such babies having oral thrush. Malnourished babies as well do develop thrush more often than not. Another thing, mommy could be having thrush on the nipple, and it can be transferred to the baby while they're breastfeeding. How can you know that you have nipple thrush, you as the mother who's now breastfeeding the baby? And by the way, oral thrush can infect any baby that is either bottle fed or breastfed. It's not exclusive to one or the other. Any baby who's either being bottle fed or being breastfed can equally have they both have equal chances of actually getting the oral thrush. Yeah. So how can you know that your nipple is affected or is infected with thrush or candidiasis? So first, before you were breastfeeding just fine, and now all of a sudden your nipples are sore after every subsequent breastfeeding session. So after you finish breastfeeding, you notice that your nipple is now sore and is painful. That could be an indication that you're having you're having nipple thrush. Another thing that can also indicate nipple thrush is you might develop some wounds or some sores around your nipple. That can also be a good indicator that you're having nipple thrush. However, it will be good that you get to be checked out by your physician or your primary healthcare provider, so that they can be able to treat you, both you and your child. For you, you'll definitely need antifungal cream, which you can wash. You should make sure you wash it off before the next nursing session or the next breastfeeding session, so as to avoid baby getting the cream ingested. However, I think I've covered most of everything that I wanted to talk about in this video. So see you next time. Please do subscribe and hit the button. Love and love, Dr. Saru. If you have other questions as to what you'd want to know about this particular topic that we discussed today, comment down below. Be sure to follow me on all my social media platforms, Dr. Pendo Saru, and I'll definitely answer you back.